Thank you so much for having me.
Absolutely. Thanks for coming. I mean, I love being a conduit for information, and I had no idea what was going on. Tell us a bit about Seattle King County Clinic.
Yeah, so Seattle King County Clinic is a once a year pop up healthcare clinic that takes place at Seattle Center. So we transform facilities on the campus into a operational healthcare facility. And in the case of 2022, this is our first clinic coming back from the pandemic. Our last clinic was February of 2020. So we kicked off with a vision clinic this year and transformed a couple facilities, brought back our volunteers and our community and partner organizations. And we were able to serve just over 1,000 patients over the course of those 4 days to receive free vision care and free prescription eyeglasses.
This is a huge deal. I mean, we talk about different ways that, King County leads, that Seattle leads. This is really big because we know vision expenses can really be a cost burden to many families, particularly those that are in low income areas. How do you guys reach out to make sure that families are aware of these opportunities with the clinic?
Yeah, that's a great question. Thankfully, we have over 150 different organizations that we work with in the Seattle and greater Seattle community. So we try to reach out to those networks and those partners, different media outlets to get the word out, get flyers out into the community. So we really do try to make those communications into those areas throughout the region because, like you said, vision services. It's actually one of the hardest services to find and fully covered. That's just something you really don't hear about very often. So we really work together with our organizations to get the word out and spread it throughout the community because we know so many people need access to care.
Yeah, I mean, I think about the fact that I'm so grateful that we have in my neighborhood in Federal Way a local vision clinic right there. For me, I was like, okay, I got connected with it as a young mother.
Mhm.
And so, my first son needs glasses. And as he was doing sports, he's like, Mom, I need to, merge over to contacts. And I was like, okay, the insurance doesn't cover that part. Right. So I know personally about some of the costs that I experience as a mom who has a child who needs glasses, right? And also myself wearing glasses and his father wearing glasses. I mean, we needed that. And so this is really great. I mean, you guys have wrapped up what you've done for 2022.
Yeah.
Now you're looking at, okay, how do we make a even greater impact? 1,000 families, 1,000 eyeglasses going out. That's huge. That's a huge impact. What are you guys looking forward to for 2023?
Well, our organizers are working really hard, and we're hoping to return in the spring of 2023 to come back with our full clinic. So, medical, dental, and vision services. And usually in a full operation, in the past, we've seen about 1,000 patients per day and then 1,000 volunteers per day. And that includes all of our healthcare providers, our general support volunteers, and then again, our patients are coming from all over the region, outside of Seattle, as far east as Spokane, even out of state.
Wow. I mean, that's because clearly healthcare is necessary. I mean, this is a really great example of that. There's a lot of push in terms of like free healthcare for all. We've heard about that. We know, Obamacare and trying to get some services out there, but it's clear that there are still some voids to be filled and some gaps that are out there for folks. You're talking about all range of medical services. Tell us a bit about those partnerships to make this happen, because clearly that has got to be a huge part of how you guys are able to make such a great impact.
Yeah, definitely. Without our partnerships with healthcare organizations, different civic agencies, other nonprofits, and then in collaboration with Seattle Center, those are where our facilities are. So without them, this is not possible. And without our volunteers, they are the backbone of this operation. They show up and we're able to treat people. So, the barriers to healthcare for the under and uninsured populations and even those who might have health insurance, but just doesn't cover everything. Or like you said, you've got to cover care for one or two family members, and then someone else isn't quite able to get the care that they need. We see a lot of families and a lot of patients just coming to receive the services that maybe they couldn't fully get through their plans. So without those organizations and partnerships that we have, this really isn't possible. So we are so grateful for the community support that the clinic gets. We're very, very excited to hopefully return with all services next year.
Well, it sounds exciting for sure. I'm glad that you could come and shed some light on it. I had no idea about it until I read up on it, and I'm like, whoa. And so to hear those numbers, you're talking about 1,000 patients a day. When you guys have these clinics for multiple days, that's huge.
Yeah.
Make sure you look right there, because it sounds like you guys are always going to be in need of volunteers. Look right there and let folks know how they can get plugged in.
Yes, through our website, seattlecenter.org/SKC clinic. We have a lot of information on how to become a volunteer. We have a lot of patient information as well, and we'll be making our announcements about 2023, as soon as we're able to, but we always need volunteers, general support, and healthcare professionals. So please come out once you hear about the clinic, and we're looking forward to having you.
Absolutely. Franny, thank you so much for being with me and shedding some light on this amazing clinic and effort that y'all are doing over there at Seattle Center. I really appreciated you coming on today.
Thank you so much for having me.
Absolutely. I mean,